the cervix. It is not necessary to close the ring forceps tightly. Lock the forceps until only one click is heard. Exert gentle traction on the anterior lip of the cervix using the ring forceps in your left hand. Hold the placental forceps in your right hand and pass the IUCD just through the cervix. Avoid touching the IUCD to the vaginal walls as you get near the cervix, as this may contaminate the IUCD and cause infection later. Be certain to keep the placental forceps closed and the IUCD in place in the forceps. Once the IUCD has passed through the cervix, remove the ring forceps from the anterior lip of the cervix and leave aside on the tray. Be sure you are standing at the foot of the table in line with the woman's body. Move your left hand to the sterile towel on the abdomen and place it in the midline of the abdomen, over the lower part of the uterus. This sterile towel helps to keep your gloved hand sterile for the remainder of the procedure. Place your hand in the midline on the lower part of the abdomen with the base of your hand on the lower uterine segment, just above the symphysis, pubis, and the fingers pointing toward the woman's head. Gently push on the lower portion of the uterus to elevate the uterus in the abdomen and straighten out the lower uterine segment. There is a sharp angle between axis of the vagina and the axis of the uterine cavity. It would be difficult for the instrument to pass through this angle. Sometimes providers can think they are at the fundus of the uterus when in fact their instrument has only reached the back wall of the uterus. To smooth out this angle and allow the instrument with the IUCD to pass all the way to the fundus, it is important to elevate the uterus. The provider must place a hand on the lower part of the uterus and push the uterus up in the abdomen. This makes the angle smooth and allows the instrument holding the IUCD to pass all the way to the fundus. This is a critical step in the process of insertion of the postpartum IUCD. Continue to apply gentle upward pressure on the midline of the uterus. Move the IUCD upward in the uterus by advancing the placental forceps upward in the uterine cavity. Angle the forceps in a manner that points toward the umbilicus. Be sure to keep the placental forceps firmly closed so that the IUCD is not released in the mid portion of the uterine cavity.
Kasi it's a player.
Side.
Maintain gentle upward pressure on the uterus to keep the vaginal uterine angle straight. Keep the forceps closed so that the IUCD does not get displaced during insertion. Gently move the IUCD upward in the uterus in an angle toward umbilicus. Follow the contour of the uterine cavity. Continue moving upward in the uterine cavity toward the uterine fundus until a slight resistance is felt. Stop immediately when the slight resistance is felt. Take care not to perforate the uterus. There are 3 signs that suggest that you have reached the uterine fundus. First, you will feel that you can't advance the forceps any further. Second, you will feel the edge of the forceps with your left hand through the abdominal wall. And third, you will see how much of the instrument has entered the vagina and uterus. Typically, you will find that your right hand is at or close to the woman's perineum. All these signs suggest that the top end of the forceps has reached the fundus. Open the forceps and release the IUCD at the fundus. Sweep the forceps to the side wall of the uterus, keeping the forceps in a slightly open position. Slowly withdraw the forceps from the uterine cavity. Be sure to keep the forceps slightly open while removing it. This will prevent the forceps from catching the threads of the IUCD and accidentally pulling the IUCD downward as the instrument is withdrawn. Stabilize the uterus with your left hand on the abdomen. Continue until the forceps are completely out of the uterus and vagina. Place the placental forceps back on the instrument